Hello and welcome. This is Health and Wellbeing and I am Lois Apasambo. Health is not a luxury, and that is why when we find ourselves in a health crisis, we go out of our way to ensure that we solve it no matter what it takes. And this brings to fore the concept of right to health and universal health coverage. This underlies the importance that everyone is assured of access to healthcare. Nigeria has been on a journey to achieving this, and we're beginning to see improvement as some state governments are taking proactive steps to achieve this. For example, the Kaduna State government and Zipline, a drone logistics company, announced the first medical drone delivery service in Nigeria. The company uses its logistics network of autonomous delivery drones to provide medical supplies to health centers across the state. I had the opportunity to visit the site in Pambegwa, Kaduna State, and it was a nice experience. Watch this. Across the skies of Nigeria, a new fleet of miniature airplanes has been flying. These small planes, called Zips, are revolutionizing the way medical commodities are being delivered to the hardest to reach areas in the country. In the rural community of Pambegwa in Kaduna State, the first Zipline facility was launched in Nigeria. Supported by the Kaduna State government, this facility uses a logistic network of autonomous delivery drones to deliver medical supplies to hard-to-reach communities in the state.
Kaduna State welcomes Zipline and its advanced unmanned aerial vehicles or drones technology for instant, safe and secure delivery of medical supplies and consumables to our healthcare facilities. It is a safe, secure and effective technology that will help to advance our government's agenda to improve access for our people to decent health services.
The plan for Zipline is to serve the unreached, to make sure that every human on earth gets the desired health care that they require. So what we are trying to do in Nigeria, as we are doing in Rwanda, we are doing in Ghana, we are doing in Cote d'Ivoire and even Kenya, is the same thing we're going to do here. We're going to ensure that every hard-to-reach area, every hard-to-reach health facility, every hard-to-reach individuals, no matter where they are located in Nigeria, get the required and desired healthcare that they need. And how do we do this? By instant delivery of these commodities. It's as simple as that.
Accessing healthcare has been a struggle for a lot of Nigerians in rural areas. And for Malam Muhammad Lawal, this had been the reality for most of his life until recently, when he was down with chronic diarrhea and in need of urgent medical attention.
I started vomiting. I vomited throughout the day till 12 a.m. At this point, nothing else was coming out except the medication I took. By this time, my stomach started hurting. From 2 a.m. till the next morning. I was then taken to the healthcare at Tashan Nabai.
He said he started vomiting since in the evening, and after some time, he started stooling around 4 a.m. His younger brother called me and told me he'll be bringing his brother to the health center. He explained the situation and asked if there will be medication available for him. Knowing my relationship with Zipline, I was assured that if I sent for an emergency delivery, I would get it because they had gone to one facility and they were told that there was no medication. But I confidently told them to come, and they brought him in a car. When they brought him, he couldn't walk. They just managed to bring him to the clinic. As soon as I requested for the emergency delivery, it was delivered instantly, and I commenced treatment on him. After giving him the medication, thank God he got better.
Whenever there is such an emergency, if medication is not gotten on time, anything can happen. But we were just given the medication and it was only one phone call away. Of course, this is a progress.
This initiative has become a sure lifeline for Malam Lawal and many others in Kaduna State.
The follow-up call we made after the delivery, Mr. Rabiu said they were able to administer it and the patient was resuscitated. We knew at that point in time that the job we do, it's important. It's saving lives it's beyond just what we see every day. This is you doing a job that makes a difference in the community.
The state government says this will bring about an overall improvement in the health sector.
It's worthy to note that this project is a significant step towards closing the gap in quality healthcare service delivery within the state. This is because it will significantly reduce the difficulty people experience in accessing essential medicine.
Accessing remote areas in Nigeria has always been a challenge due to the lack of roads, bridges, and other infrastructure. This has left many rural communities without access to healthcare and medical supplies. But now, with the help of these little zips, medical supplies are being delivered to these communities with ease.
What Zipline has done with the very wonderful technology is to cut short, one, the travel time and how long it takes for a life-saving medical product, particularly which is the use case for Kaduna for now, right, is to cut short that travel time, right, so that medicines are upon order are instantly delivered to the facilities. And also in terms of access, I have been to communities where there are no roads. I've been to also communities where you are told not to travel until it is the dry season. Basically, what we're doing here is to increase access to life-saving medicines to places or to facilities or people who are basically in hard-to-reach areas.
Since we started in Kaduna, we've been able to impact the supply chain in the state in different areas, not just supplying these medical commodities to the facilities. We've also been able to help the state government in integrating its services to the different facilities. We've delivered over 500,000 vaccines and over 1 million medical commodities. Those are the items we are currently delivering in Pambigua, where we are currently located in Kaduna State. We serve over 300 facilities in Kaduna and we're still counting.
The zips are also making it easier for medical workers to provide care to those in need. Abdulaziz is in charge of the health facility at Haingada, a community in Pambigua. He says work has never been as exciting as this. On this day, Abdulaziz is in need of medication for one of his patients, and with just a phone call, his order is placed.
Thank you for calling Zipline. My name is Yayuli. Please, how may I help you?
I want to place an order for Ampiclos capsule and Pirozicam.
We'll process it and you'll get an update on your phone as text message telling you when to expect the product.
Five minutes later, his order is delivered.
Before, in this village, we didn't have a chemist. Sometimes when people come to the facility, we have to refer them to Pambegua. If the medications can't be gotten at Pambegua, we just manage with what we have. But with this new innovation, even while examining the patient, we can place an order for medication. Before we are done, it will be delivered. And before, we had to go to PHC Kare to get RI vaccines on Wednesday because we have sessions on Thursday. During the raining season, sometimes when we go, the rain would have flooded the bridge, stopping us from crossing. We would have to wait till the next day. On days like that, we have to forfeit the vaccines. But now we just place an order on Wednesday and then get the vaccine on Thursday by 9 a.m. before the patients arrive at the facility. This has really helped because previously the patients hardly come to the facility. Even those who need vaccines don't come because of the lack of medication. When they come once or twice and they don't get the medicine, they stop coming and go to the general hospital. But even for the fact that a drone brings our medication, so many people now visit the health center.
We do normally offer 24-hour services in primary healthcare center from Kaduna. So before, we used to buy drugs from the Kashma, that's Kaduna State Health Management Drug Services. So with the effort of the Zipline, actually we reduce at least 65% issues of delay in supplying of drugs, because once you apply or make a requisition, within 5 minutes to 10 minutes, you will get your drugs. It reduces the maternal issues, maternal death, morbidity, and other rates of either morbidity or mortality rates, particularly maternal issues. We do have a lot of clients, unlike before. Before, we used to see 20 to 30 clients. So with the effort of Zipline drugs supply, now we used to see 40 to 50 a day.
With a central pharmacy, medication are properly stored and equally distributed.
Our motto is that every human being on earth has equal access to medication. So we want to have all the facilities on the same level. On the same level here being that they all get, they all have equal access to medications. So we don't prioritize one facility over the other. Whatever you need at any point in time, we give you. And then we don't give you too much that you won't, you may not be able to consume. So in that way, we cut off, things like expiries or overstocking. We don't send, bulk or medications in bulk to facilities. We are here to just make sure that they don't always run out, and whenever they need, we are there to service them. So that's what we mean by our on-demand delivery service. And that also ensures equitable distribution. Now, classically, what happens in conventional settings is this. You have bigger facilities, holding almost all the products in their in their warehouses in the hospitals, at the detriment of the smaller facilities. Yeah, the small facilities just have a little or none at all, while we have a lot and they are not using. So at a point in time, you find out that those medications have been hoarded, so to say, by the bigger facilities get expired, while other people need them elsewhere. So that's what we try to do as Zipline again, to make sure that there's an equitable distribution. So we give every facility what they need at that moment. Whenever they are out of it, they can always call. A lot of our facilities, due to one thing or the other, may not have the proper equipment for the storage of cold chain medications like the vaccines, right? So what Zipline does is we provide this service for them. We keep their cold chain medications. Whenever they need it, they just give us a call and then we deliver. So they are not burdened about how to store these things again.
Equipped with batteries, these small planes release zero emissions, a step in the right direction to achieving Nigeria's 2060 zero emissions target.
It is fully autonomous, which means nobody controls it like the conventional drone. It flies at 110 kilometers per hour, an average speed of 110 kilometers per hour, and it has a range of 210 kilometers. So we actually have a service radius of about 90 kilometers. And this drone is actually battery powered, a lithium ion battery. The entire drone has a mass of 20.1 kg with a maximum payload of 1.75 kg. And it can remain in flight for about 3 hours.
5 years after starting up in Rwanda, research from the University of Pennsylvania found an 88% reduction of in-hospital maternal deaths due to postpartum hemorrhage as a result of Zipline's logistics and delivery system. The launch of Zipline's drone delivery service in Nigeria also has the potential to significantly improve health outcomes in the country, like in Rwanda.
That's a great boost for the Nigerian health system. Well, today on the program, I am being joined by a public health expert and the program manager at the Center for Social Justice, Mr. Martins Eke, to discuss what this means for the health sector. You're welcome to the program, Mr. Martins, and it's nice having you once again on the program.
Yeah, thank you.
Well, just as we've seen, you've been on the program quite a number of times, and one of the things we constantly keep talking about is universal health coverage, the right for everyone to have access to healthcare. And we see the Kaduna State government come up with an initiative, and most interestingly, an innovative one, partnering with Zipline, this drone company, to make sure that health centers in rural areas and hard-to-reach areas are able to access health supplies at any time that they need it. What can you say about this, and what does this mean for the healthcare system?
Well, one thing this initiative would achieve is access to the medical supplies, drugs products, vaccines, both your immunization vaccines, COVID vaccines, and all of that. So the key thing there is access. With respect to how it contributes to universal health coverage, it's in the sense that some of these communities, like you said, ordinarily vehicles will find it difficult to access those communities. But with this initiative, the drones can get there easily. Not just getting there easily, but getting there in good time. So locations where vehicles will need hours, right, to access, the drones can get there in much less time. Now, apart from that too, apart from vehicles finding it difficult, there's also the issue of insecurity. There's also parts of Kaduna State that, because of insecurity, it may be difficult for medical supplies to go there ordinarily. People wouldn't want to put themselves at risk going to those insecure communities to supply these medical products. But with the drones, the risk of insecurity is minimized, to the barest minimum. And then an interesting dimension, which I would even want to look at, is the issue of cost. Using the drones to deliver these health supplies actually cost less than using your usual and normal transport logistics. So what it means is that the health sector will now have some, permit me to say, savings, right, which will then be plowed back into other interventions that will still improve the health service delivery within Kaduna State. So in the long run, from all angles, it's a very wonderful innovation, and it will go a long way to increase access to healthcare services.
We're talking about sustainability. If this is sustained, where do you see the health system in, let's say, 5 years?
There would be an improvement in the health indicators of Kaduna State. Remember that maternal and child mortality, right, occurs sometimes because medical supplies did not get to the primary healthcare facilities as at when it was needed. Sometimes women die because some drugs and injections which they need during delivery process is not available. But with this new innovation, those drugs can be delivered to the health facilities quickly, and then those women will be saved. Those children will be saved. So we will see a situation where the maternal and child and under 5 mortality in the states will significantly reduce. Apart from that too, even other illnesses that are not necessarily connected to mother and child health, some of them too we see situations where people's health condition get worse because they still could not access the medical supplies that they needed. So generally, if this innovation is sustained, what will happen is that the health indicators in Kaduna State will improve significantly.
So what role can this drone delivery system play in reducing health disparities and improving the health outcomes for most especially underserved populations?
So with respect to inequity in access to health services, it boils down to the fact that certain areas are hard to reach and are consequently underserved, while some other areas, because they are probably within the city center or easy to reach areas, they receive adequate healthcare service delivery. So with this drone, those areas that could not receive adequate supplies will then receive supplies as soon as it is needed. So what the drone will do is that it will reduce the inequality in access to medical supplies and medical service delivery generally in the state. So what we will then see is that that gap between the haves and the have-nots, that barrier in access to healthcare between the rich and the poor will start reducing little by little to the point where it is almost not there.
So how can this help with emergency situations in the country? You know, some years back, the federal government had launched NEMSAS, and we haven't necessarily seen something very tangible come out from this. How will this help emergency services in the country?
I think it will go a long way. It will go a long way because the company itself, one of the things that has stood them out is the speed with which they respond to issues. Remember that Kaduna State is not the first place in the world where we are having this service. In Ghana, there's something of this already ongoing. The drone service in Ghana is quite strong. Even before Ghana, there was Rwanda. And then in some other countries in the world too, like Philippines and India, some of these things have been tested a bit. And one thing that stands the company servicing Kaduna State out is their efficiency, the speed with which they respond to demands that are placed on them, especially in situations in emergency. So because they have that organizational consciousness and responsiveness to emergency, it will then, play down, or it will then just affect Kaduna State Health Service delivery positively with respect to access to emergency, because the company who is delivering these drugs, these supplies, these medical supplies, have that consciousness that they need to deliver on time. Therefore, treatment during emergencies too within the Kaduna State health system would also happen quickly. Now, imagine a situation where there's an emergency, like you've said. A certain drug or a certain injection needs to be administered on a patient quickly in order to save that patient's life. What the primary healthcare center needs to do is just to place an order with the company that handles the drone services. And the whole process has been made easy such that through WhatsApp, through SMS, through phone calls, orders can be placed. And then the company will deliver those drugs or injections or medical supplies that are needed within the shortest possible time. Now, because these companies are doing well, at least to the best of my knowledge, it means that those drugs and injections will arrive at the primary healthcare center where it is needed quickly. So because it is sent quickly, the emergency will be handled, the emergency will be taken care of, the emergency will be addressed, and then the life will not be lost. This is a better arrangement than having to depend on vehicles, transfer the drugs and supplies from wherever you kept them to where they are needed.
So we're seeing this at state levels, not even at the federal government level, So states are beginning to buy in Kaduna, Cross River, Bayelsa. What does this mean for the healthcare system?
This is like the testing phase. It's like the testing phase. I know this idea is also, coming on board in Cross River State. You've also mentioned the Bayelsa State and so many other states. So people are embracing the ideas little by little, trying to see what it does. And then they feel as we are getting from Kaduna State is that the outcome is positive. People who are in the health service delivery are confessing that they are seeing improvements in health indicators and recovery rates because of this particular service. So once Kaduna State begins to give positive testimony, Cross River, Bayelsa, and all the other states give positive testimony, it will then mean that those who were a bit reluctant to embrace the idea will now, quickly embrace the idea. So even the federal can then buy in, because sometimes all these things depends on political will or desire to be responsive to new technologies, right? So the leadership of the government establishment, whether at the federal or state, will go a long way to determine whether this innovation will be brought to the government, whether federal or state.
So let's talk about political will, just like you've said, and sustainability. We're just about to have a change of government. How do you think this will work out?
In the case of Kaduna, I think that the governor-elect is from the same political party with the incumbent governor. So I would think that he wouldn't, just discard most of the policies and ideas that the predecessor brought on board. So I think that there will be continuity. Apart from the issue of the political party that the incumbent is coming from, generally it's a wonderful idea. I don't expect any incoming governor or any new political office holder to discard a wonderful innovation simply because it was brought by his or her predecessor, whether from the same political party or not. So I think that because the idea is good, every administration that is coming on board will embrace the innovation and probably just play its role to see that the services continue in the state. I don't think that any right-thinking official, whether a state governor or any other political office holder, even the president, will discard a wonderful idea because of the change, in political office. So generally, I think the idea has come to stay, irrespective of the government in power.
I'd just like to get your words and your opinion on this. Is this an initiative of the states and the federal government should key into?
The answer is an emphatic yes. Capital letter YES. I want to urge all state governments, including the federal government, to embrace this idea. This is the way to go. Remember, I said it is not only Nigeria, right? We are seeing this in some other countries in Africa, Ghana, Rwanda, and so on, and the testimonies are good. We're also hearing that these things are happening in some other parts of the world outside Africa, and the testimonies are good. Within Kaduna State, where it has been in place for a little while now, the testimony is good. So there's just I think no state should be left behind. Even the federal government should not be left behind. Everybody should embrace this technology. Come to think of it, the advantages are more. The advantages are more. I've talked of the fact that because of the lower cost in sending these drugs through with drones than your usual logistics. I mean, who doesn't want to save costs? Any state government that wants to save costs should embrace this idea. Apart from the issue of cost, I talked of time, right? The drones deliver the supplies in less time than your normal transport logistics will do. And in medicine, time is everything. The time that the medicine arrives at the facility goes a long way to determine if the patient will survive or not. So timing is everything. And apart from that too, it reduces wastage. It reduces wastage. Imagine that you've taken a certain number of medical supplies to a health facility, and for one reason or the other, the health facility didn't use up all of those medical supplies. It means that those supplies will be dirty when they are needed. And in some cases, they will not be needed for a certain length of time, and then the supplies will get damaged. Some of them may even expire, right? Some of them may even expire. In instances where you need special temperatures to store those medical supplies in the health facility. If you don't have such conditions, they may become a waste. But with this new arrangement, nothing will expire, nothing will become a waste. You are sure that when you need it, you request for it and you get it instantly. So it makes economic sense. Apart from making health sense, it makes economic sense too for that particular state to embrace the idea. So I think that everybody should just embrace the idea. And then, of course, the issue of hard to reach areas. There's no state in Nigeria that doesn't have hard to reach areas. So if this technology will take the medical supplies closer to the hard to reach areas, I don't see any reason why any state or federal should, be reluctant to embrace it.
Well, thank you very much, Mr. Eke, for taking our time to be here with us on the program. We sincerely appreciate your presence. Thank you so much. Well, that's how far we can go on the program today. Keep it a date with us. Same time next week. I am Lois Apasambo. Many thanks for watching. Do stay safe.